We basically have one of our pillars as the endocrinologist. Today, we want to speak to him about why obesity is considered a disease, what are these GLP-1 drugs about, are they safe to take, are there any side effects, who can take these, and if there is something more in the future. So, come, let's deep dive with Dr. Deep Hathi.
Sooner India is going to be the diabetic capital of the world.
What is obesity? I mean, is it a medical term or is it basically an English language term?
Obesity is something which is a chronic, relapsing, and a progressive disease. Obesity, almost 60 to 70% of our body makeup is genetic in nature. So there is again a very negative feedback which is going about this molecule in the social media. Mainly it is about the negativity which has been spread. The role of our clinic comes into play is because we not only treat obesity as a single way of losing weight. We are looking at diet, exercise plus the medical therapy. So the major part of or major advantage of it is that once we stop the medicine, we will make sure in such a way that you don't regain weight like you were there previously.
Hi, this is Dr. Saumil Shah. I'm a plastic surgeon, and basically, I've been dealing with patients suffering from obesity since a long time who would come to me after losing weight, and we would do surgeries for them. We basically would not operate on obese patients. Uh, we've also learned about obesity a lot during our MBBS days and otherwise as well. What I realized very recently was I hardly knew many things about obesity, especially how it's an endocrine disease. Uh, it's a really interesting thing. It's something that has a lot of relevance in today's day and age. The Metabolic and Obesity Health Clinic, MOH Clinic, that we've started, we basically have one of our pillars as the endocrinologist. Today, we want to speak to him about why obesity is considered a disease, what are these GLP-1 drugs about, are they safe to take, are there any side effects, who can take these, and if there is something more in the future. So come, let's deep dive with Dr. Deep Hathi. He is basically going to be the endocrinologist who's going to be treating all of our patients, giving them these medications, prescribing this to them, and we need to know more about it. Thanks, Dr. Deep, for joining us today.
Thank you,
Yeah.
Dr. Saumil, and thank you for having me here for this podcast. So, as we all know, that obesity is a growing health problem.
Yes.
Now, there are a lot of patients who are coming, not only adults, even childhood obesity is on the rise.
Right.
So, we are getting a lot of queries now, and because of the availability of these medicines, now people are self-aware about obesity and they themselves want to get treated about this thing.
Which is a good thing. I mean, obesity is one of the major chronic things affecting
Yes,
us.
and sooner India is going to be the diabetic capital of the world, and the major reason of getting diabetes is naturally obesity.
True.
So treating the root cause is better to prevent the diabetes future.
Yeah. So diabetes, heart health, brain health,
Yes.
everything basically related to obesity. So let's start immediately with the most basic question that I and most people have, and sometimes we have a lot of misconceptions about this as well. What is obesity? I mean, is it a medical term or is it basically an English language term?
So basically, when we define obesity based on the guidelines that we have, obesity is something which is a chronic, relapsing, and a progressive disease.
Okay, so
Where-
explain all of these
Yes.
terms to us.
So
please.
why do we say chronic? Because it is something which has been developed over a period of years.
Right.
Why do we say relapsing? Because most of us lose weight, but maintaining it over a longer time is not possible. So that is why we tend to relapse or we tend to gain weight.
Okay,
And it's a progressive disease
right.
where there is a fat accumulation, and this fat accumulation in our adipose tissue can cause a lot of problems. Lot of obesity related complications are there which can occur over a period of time.
Right. Okay. So basically, when you call obesity a disease, what do you typically mean by it? I mean, what is meant by a disease?
So basically when we say disease is basically not at ease.
Okay.
So there are a lot of problems which are associated with obesity. For example, like I said, it's a major cause of type 2 diabetes.
Right.
Also, obese individuals have hypertension, they have high cholesterol. When we say younger patients, females have, especially they are linked to PCOS.
Right.
In elderly population, they start having osteoarthritis at a very early age. They have obstructive sleep apnea, they have fatty liver. So, and most importantly, obesity is also linked to certain cancers.
Right.
So we have to treat obesity as a root cause and prevent all this complication later in the life.
Okay. So, but then would you call obesity as the cause of all of this, or obesity is the disease by itself?
It's a disease by itself which is linked to all this thing.
Okay. So, when you call it a disease, does it mean that it has treatment for it, or does it mean that medical science knows as to how obesity happens, or what is the reason why obesity happens?
Yes, so basically obesity, almost 60 to 70% of body makeup is genetic in nature.
Right.
Rest 20 to 30% of it's determined by certain factors, for example, social, behavioral, psychosocial, epigenetics. So these are certain other parameters which look into it.
So, in this, basically, when you say that it is genetic, does it mean that it is passed on down
Yes.
hereditarily?
Yes.
Can someone who does not have obese parents become obese themselves?
So then, when suppose if there is a no genetic history of obesity, and if the person is obese, then we have to look out any hormonal reason of obesity.
Right. Okay. So, what would be the common hormonal reasons that?
So when we look at the hormonal reason, the most important that we look is thyroid.
Right.
Patients with hypothyroid do have a tendency to gain weight.
Okay.
Apart from this, PCOD patients also have increased tendency to gain weight because of the insulin resistance. Apart from this, there are very rare endocrine causes, for example, like excess cortisol in the body, which we call as Cushing syndrome. Then there are other few
Diseases.
rare diseases that we look at genetic causes of obesity.
Understood. So, basically, we are talking about obesity a lot. It's now back in something that's trending because I think of the GLP-1 drugs that have become so famous and everybody wants to know about them. There's a lot of curiosity about them. So, what according to you, not what according to you, but what are these GLP-1 drugs? Are these things that are medicines or are they supplements? What are these?
Okay, so we all know that this hormone GLP-1 were traced back in 1980s. They are known since then, but they have never been explored till date. So now the medicines which has come up, this GLP-1, what they do is basically it is released from the intestine and it goes and signal to your brain, causing a feeling of fullness in the abdomen, meaning that the stomach feels full and then you don't want to eat more.
Okay.
So this is how it goes. It goes and stimulates the satiety center, and it signals that you don't have to eat more. And not only that, it also impacts or cut down your cravings as well.
So, can you give us examples of these GLP drugs that are available on the market right now?
So right now we have two molecules. One is semaglutide and one is tirzepatide. Previously there were molecules which are still available, liraglutide also, but it is not very commonly used now because of the better results that we see with semaglutide and tirzepatide.
Okay. And what's the difference between semaglutide and tirzepatide?
So semaglutide is basically it's a single GLP-1 analog, whereas when we say tirzepatide, it's a dual, meaning GIP plus GLP-1.
Okay. And so, what is again GIP? Is it a similar drug, a similar hormone? Or
Yeah, it's a GLP is again a hormone, and again GIP. Both are hormones which are released from the gut.
Okay. And both have similar actions.
Yes.
Okay.
So both have similar action. They have action at each and every level of the brain, starting from the brain to the pancreas to the gut. They have actions at every organ.
Okay. So they basically help with obesity overall,
Yes.
with improving.
Yes,
every
it
organ.
also helps in diabetes as well. So they have roles in diabetes as well as obesity.
Okay. There are a class of patients who are obese, but when we counsel them, they do tell us that they do not eat as much. So there are two people, and one person may eat more, one person may eat less. Usually, a lot of patients are there who don't really eat a lot. They eat like a very moderate amount and still are obese and can't lose weight. Will these medications, because they cause loss of appetite, and if person is anyways not having much, will it help them? Will it
Yes.
cause weight loss in people who are not eating too much?
Yes. So there are certain patients. Not every patients have overeating, or not do they have sugar cravings. There are certain type of patients who eat less, but still they are not able to lose weight. So there are other smaller mechanisms of these medicines as well. For example, they act to decrease the insulin resistance. They help to improve insulin sensitivity. Also, they try to decrease the inflammatory markers which are elevated in this patient, because obesity is a state of inflammation. So when we do a routine test, for example like ESR, HSCRP, they are bound to be increased in patients with obesity. So these drugs also help to reduce these inflammatory markers and helps to reduce weight.
Okay. So when you say it helps to reduce inflammatory markers, is it going to be helpful outside of obesity for helping like organ specific
Yes.
health other than what obesity will help?
Yes. So these medicines not only helps to reduce obesity, they have beneficial or protective role in heart disease, kidney disease, liver failure. Even these patients, they help. These medicines also help to reverse fatty liver.
Okay.
They have an important role in reducing the chances of getting heart attack. They also help to reduce the patient who have slight kidney derangement. If I give them this medicine, they halt the progression to dialysis as well.
That's really interesting to note. And so I mean, I think there is a lot of research going on in this area for these drugs, and hopefully we know more about it.
Yes.
Yeah. So so in our society, basically, we are scared to take medications. Weight loss through dieting and exercise, a lot of people have lost weight through that. Why do we need to go on these medications? Is there any reason or any reason for me to start the medications that may have side effects in the future? And can I not lose weight with diet and exercise alone?
So this is a very interesting fact that we always try to advise our patients to lose weight with diet and exercise. But there are certain type of patients, even after losing certain weight, their body weight gets stuck. They are not able to lose weight further. So this is because again of the body's adaptation to the weight loss journey. For example, if I'm keeping myself starved for a very long time, our body tries to overcome this mechanism by increasing the hormone which is called as ghrelin. So level of this hunger hormones goes up, and that is why patients tend to overeat at the end of the day.
No, so basically what you're saying is that my body will adapt to me not eating by keeping my weight
Yes.
higher. So, but if I keep at that lower weight through diet alone, will I stay at that weight? Or because we have also found that a lot of patients who go on these diets, they also increase their weight later on. So is there a reason behind that, or it's just lack of willpower on patients'
No,
part?
so it's not lack of willpower. Basically, like I said, that our body tries to create an adaptive mechanism countering the weight loss journey which you are doing. So we have to outsmart our body, try to lose weight with a different method, and this is where the role of GLP molecules come into play.
Okay, understood. So basically, they will help with countering the mechanism of adaptation, metabolic adaptation that kicks in. So, who, according to you, are the right candidates for these medications? Can it be given to everybody who wants weight loss? Can it be taken by, say, if I am a struggling actor and I am of BMI say 21 and I have to lose a few kilograms for my next shoot? Can I sort of do that?
Okay.
Or can I do that from the point of view of someone who does not want, I mean, is looking at this as, no lifestyle change, weight loss?
Yes.
Can we do this?
No.
And are these the right
Yes.
candidates?
So there are fixed criteria for whom we should use this molecule. Basically, according to the ADA guidelines, any person with BMI of more than 30 kg per meter square, or if any patient with BMI of more than 27 per kg meter square with any one obesity related complication. For example, if they have associated hypertension, bad cholesterol, or if they have other complications like fatty liver, obstructive sleep apnea, or maybe in a PCOD patient, we can definitely try this molecule in them.
Okay. So, do all patients that you put on these GLP-1 drugs, do all of them respond to these medications the same way?
Okay, so that is not true, because there are certain patients who lose weight very fast,
Okay.
who I call as a fast responder, but there are certain patients who don't lose weight, or they lose weight very slowly. So these are slow responder, but that doesn't mean that they will not lose weight.
Okay. So, but are there people who are no responders, who don't lose weight at all?
Yes, so there are in the clinical trials also, they have shown that 5% of the patients do not respond to the medicine. But before terming you as a non-responder, I want to see that you take the medicine for at least 3 months. If you are not losing weight after 3 months of taking the medicine, then only I'll tell you as a non-responder.
Okay. And another thing that we hear very commonly is when the patients come and say, or when the lot of social media, it says you have plateaued on the medication. So what do you mean by plateauing on the medication? That means that I don't get weight loss by that single every week that's happening that I see initially, or how do you call it?
Yes. So, like any other weight loss journey, for example, you do it with diet, exercise, or everything. So, there also is a plateau stage. Similarly, a plateau do occur in certain patients. But how do you define as a weight plateau? Basically, it means that patient is not able to lose weight, or there is not much change in the body weight over a period of 8 to 12 weeks.
Okay.
So, if there is no weight loss, then only we say that a weight plateau has been achieved. So, how do we mitigate that thing? So, most important is if you are on the low dose, we have to step up the dose, or if you are on the higher dose, we have to increase our intake of protein, and we have to increase our strength training, and most important is keeping hydration.
Right. Understood. Now we've understood who are the right candidates probably, but who are the right doctors? These days we are getting these medications also over the counter from pharmacists giving it. Sometimes we've heard about it. We've heard about aestheticians giving it. We've heard about dentists giving it. So I mean, can any doctor who is say MEBS or can sort of just prescribe these medications to
So
everyone?
this is very important thing which you have pointed out, because I have come across lot of aesthetic or dermatologists prescribing these medicines. Uh, the the sad part is that they are not able to manage the side effects which are coming out of it. So it is very important. I have even seen gym trainers and dietitian prescribing this molecule. So I would strictly advise going against this thing. See, we as an endocrinologist are well versed with this molecule. We know the problems which are associated with it, how to deal it. And also, if you check the label of the molecule, if you see the pen, it has clearly mentioned that it has to be prescribed by endocrinologist or anyone with an internal medicine specialty.
Understood. Okay, so basically we have to get it from the right doctor,
Yes.
which becomes very important from the point of view of managing the side
Yes.
effects of it. And coming to that, what are the side effects that you would sort of expect when you give these medications? Are there any long-term side effects that we can expect out of it?
Yes. So there is again a very negative feedback which is going about this molecule in the social media. Mainly it is about the negativity which has been spread. So I just want to clear that air about it. So there are no very serious side effects which are reported. I know that there are rare side effects, but these are so rare that if you don't take the molecule thinking about those things, you are missing out on the benefit versus the very rare side effects.
So the risk-benefit ratio is better.
Yes. So the most common side effects that we look out is GI problems, mainly gastrointestinal problems, and also these are very mild. It can be easily managed by giving some antacids or by giving some laxative if there is constipation. So there is no such serious side effect that we routinely encounter.
Okay. So people talk about pancreatitis and blindness and thyroid cancers. Are these relevant?
So definitely these are very rare side effects, like 1 in a million patients who use this molecule. And also we checked the eligibility before prescribing you the medicine. So if there is any patient who has a past history of pancreatitis or who has a risk factor of getting pancreatitis, we make sure that we don't start this molecule. Also, if there is a family history of a thyroid cancer, to be specifically a medullary thyroid cancer, we don't prescribe this molecule in such patients, and we are slightly cautious in using this molecule in patients who have a history of gallbladder stones.
Right. And what about blindness? So
So,
blindness is
yeah,
something that a
so,
lot of people
yeah,
talk about.
so there are few case reports of Nayan reported in these patients, but definitely the ophthalmic journals have concluded that the risk of getting this rare side effect is similar if you take the molecule or whether you don't take the molecule. So it is very negligible. It's like 0.29%. So it is extremely rare.
And does it happen in a regular population or mainly restricted to diabetics who have
No,
retinopathy?
no. So the thing is that we don't have a definitive risk
Okay.
factor which is leading to NION.
Understood.
So the ophthalmic side effect apart from this is basically there might be a progression of retinopathy. So when a diabetic patient is using this molecule, we always screen for retinopathy. If the patient has PDR, which is a proliferative diabetic retinopathy, we are slightly careful about using in this patient because not because this molecule directly causes this problem. It is actually because of the rapid glycemic control which is achieved with this molecule, which can cause further deterioration of this problem. But it doesn't mean that it is contraindicated. If we keep a check with the ophthalmologist, we can safely use this molecule.
So, can we take these medicines for long?
So that is a very tricky and subjective question. So for if a patient is a type 2 diabetic, definitely we treat this medicine as another medicine for treating type 2 diabetes. So if the patient has been maintaining a good glycemic control and if he is able to lose weight, then definitely we can continue taking this medicine for as long as patient wants to take. So there is no such fixed
Right.
thing about it. But in case of obesity without type 2 diabetes, definitely I want my patients to take this molecule as long as they achieve their target body weight. Once they achieve their target body weight, then we can slowly taper it off. But again, uh, if the patient starts to regain slight amount of weight, then we can again think of restarting it.
Okay. And what can help the patient sort of keep the weight down when they stop it? What is essential for
Yes. So when we talk about obesity, we always think that a low calorie diet, now because of the availability of the medicine, we always think that if I take the medicine, I'll be able to lose weight. No. Losing weight is a holistic approach. It's about diet, exercise with the medical therapy. So where the role of our clinic comes into play is because we not only treat obesity as a single way of losing weight. We're looking at diet, exercise plus the medical therapy. So the major part of or major advantage of it is that once we stop the medicine, we will make sure in such a way that you don't regain weight like you were there previously. Obviously, slight regain is expected in some patients, but we don't want a major regain.
that? Got it. There have been reports, and I think we've both seen patients who have gotten medications which have been claimed that they are UK based medications. There was a report recently where someone, not in India, but she purchased it online. It turned out to be insulin instead of GLP, and she had a near death sort of an issue. So, how common is counterfeiting of these medications, and should patients be very careful where they procure these medications
Yes.
from?
So this is a very important point, and I had come across a patient who told me that some doctor had prescribed her saying that there are two medicines which are available. One is UK based and one is Indian made. First of all, I want to clear this air that there is only one company who manufacture this molecule, that is Novo for semaglutide and Eli Lilly for tirzepatide.
Right.
And whatever the manufacturing is done at a single center,
Right.
and they only send the molecule to all the countries.
Right.
So there is nothing called as UK made or Indian made.
Right.
And you don't have to get bluff saying that this UK based molecule will only work for you, and Indian company we don't have authenticity.
Right.
So there is nothing like it. So you have to be very careful while choosing this thing.
Yeah.
Also, authenticity is definitely a doubt because I have come across in Instagram that there is someone claiming to have a tablet for GLP-1.
Right.
So I don't know about all these things, and we don't know the authenticity about it because there is no science-backed data that it actually works like a GLP-1. So
Okay.
we have to make sure and we get it from an authentic source only. So here at MOH Clinic, we make sure that you get the best and the correct molecule,
Right.
so that you don't you don't have chance of getting a counterfeit medicine.
Okay. And finally, where do you see the future of this of GLP-1s taking us? Do you think that this is going to sort of be something that is a fad that's going on, or something that will really help patients
Yes.
from the point of view of obesity, which is something which, a big chunk of our population are facing. Being a developing country, we still have so much obesity. So where do you see the future of it, and are there any more drugs,
Yes.
newer drugs coming
So
on
I
the
would
way?
say this is just a beginning.
Right.
There are lot of drugs which are in the pipeline.
Right.
This is just a snapshot of it. So in next few years, I'm hoping at least 2 or 3 more molecules coming up. Uh, now we have just 2 receptor agonist molecule. In the near pipeline there will be a 3 receptor agonist or 2 receptor with a different mechanism of action.
Right.
So hopefully we have a lot of good molecules which can almost reduce weight as similar to the bariatric surgery.
Okay. So, what would be your take-home message for patients who want to start these GLP-1 drugs?
So my important take home message will be not losing weight only with GLP-1 but losing in a correct way, and not only losing or dependent on medicines. You have to diet and exercise along with the medicines, because if you lose weight you will lose muscle with this molecule.
Right.
So we don't want you to lose muscle, so exercise and also a protein diet will help you losing weight in a correct manner, so that at the end of the weight loss journey you look good.
Right. So, and my advice to them would be get the right doctor, get the right clinic, get the right sort of help holistically that you need, which we would do at MOH clinics. If you have any other questions from us or from Dr. Hathi, you can always get in touch with us, and we would be happy to help. You can even comment in the YouTube comments below, and sort of we will get back to you. Thanks.